Hi, it's Bill, the knee pain guru. Welcome to today. Well, today is Monday, July 22nd, 2019. And today's topic we're going to talk about is what to do when physical therapy causes you more knee pain. Quite frequently, that's what happens. I run across a lot of people that are searching for alternatives to physical therapy because their physical therapist puts them in so much pain. So today we're going to go through 3 things you can begin doing when you find yourself in that position, or if you find yourself in that position. We'll be answering questions in a few minutes. So if you have any questions about physical therapy, exercise, your diagnosis, doctors, whatever the situation is, put those in the comment section. I take those comments and I find themes, I find patterns, and use those for future videos. We have those twice a week on Mondays and Thursdays, generally in the mornings. Today, we're running a little bit later, so here we are in the afternoon. Make sure to give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications so you're notified of when those videos do go live. So what are we going to do? What are you going to do when physical therapy causes you more pain? And I see physical therapy working very much in a box, that it's like they're doing what the doctor has prescribed and what falls underneath insurance codes that they will be reimbursed for. So physical therapists, for the most part, have a very limited scope in terms of what they are able to help clients with. And a lot of times those physical therapists will push their clients through to get that done regardless of how their client's knee feels, their patient's knee feels after that. So the first thing you can do when you find yourself with a physical therapy is making it worse, or making your knee feel worse, or the physical therapist pushing you through a range of motion that your knee just does not want to go. You can tell them straight up, this no longer works for me. Think about that. What a concept, to be able to voice to them what works for you and what doesn't. And I think this is very important because a lot of times we tolerate things we don't realize we need to tolerate. And we will tolerate the pain because we think that's what we're supposed to do to get out of pain. But in actuality, if what you're doing that you're thinking is going to get you out of pain is actually putting you in more pain, well, there's a disconnect there. So absolutely share with the physical therapist that what they're doing, this pain, pushing you through this range of motion, just no longer works for you, then we need to find something different. Which leads to the next point. Ask them what are the other options? Are there less painful options to achieve the same result? Are there more comfortable? Think of that one. Are there comfortable options that are available that they could suggest to either strengthen the legs or increase the range of motion in the knee? Because many times people are going to physical therapy because their leg is weak or there's a lack of range of motion. So they're going to physical therapy to strengthen the legs, increase the range of motion. And so ask them, what are the other options? Do you have other options that would allow me to strengthen my legs and increase the range of motion that isn't going to put me in pain for days later and cause me to limp? So that's the second piece. And third, if the PT doesn't have other options, find another PT. That's always an option. Remember, this is your health. This is your body. This is your life. This is how it affects you. So you have to take control of that. It's very important that range is moving. So you have to take ownership of that. And you can no longer be at the whim of what a professional is telling you to do if on a solid level that you know it's making you feel worse. There has to be an ability for you to communicate with that professional in a way to get you the results you're looking for. And if that's not happening, There are other professionals out there that will be able to support you in that process of your knees healing, of strengthening your knee, of increasing the range of motion, that isn't going to wreck you for days afterwards. So that's what I had to share. If you have any questions, comments that you would like to contribute to this, please enter those in. And if that does not happen live, I monitor all of the comments. So if this is on a replay, you can absolutely enter those in later, and I'll check those out. Boy, the rain's really got intense over here. So that's what I have to share. I don't see any comments coming in, which is okay, perfectly fine. Check and see. And we are good. Okay. Thank you so much for being here. This is Bill Paravano, the Knee Pain Guru. Appreciating you and your journey, that you're searching out solutions to help your knee feel better. Thank you so much. Going to sign out for today, and I will see you on the next video.